Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Unilateral pleural effusion and its causes. So first, let's look at the right-sided pleural effusion. So predominantly the right side. So in terms of the right side of the pleural effusion, it can be through the cirrhosis of the liver. So it is by the cirrhosis of the liver, and this is the hepatic hydrothorax. The hepatic hydrothorax. Next is it may be due to the amoebic liver abscess. So amoebic liver abscess. Then comes the Meiggs syndrome. There is the Meiggs syndrome, and also in presence of the cardiac failure. So in terms of the cardiac failure. So here in cardiac failure, the bilateral is very greater than that of the right side. Now let's move on to the left, which is predominantly to the left. So predominantly to the left, it includes the acute pancreatitis. So there's acute pancreatitis. Next is also the presence of the aortic dissection. So there's aortic dissection as well. This is all with the left side. And there is a esophageal rupture. So there's a esophageal rupture as well as the presence of the Dressler syndrome. So there's acute pancreatitis, there's aortic dissection, there's esophageal rupture as well as the presence of the Dressler syndrome. To learn and grow daily like this, please do subscribe.